Star, who did a great job this year, and I'm going to turn things over to him. One thing, the nominations this year, since it's virtual, the recommendations were emailed to you both on, I believe, Thursday and then yesterday as well. So, Adam, I'm going to turn things over to you, partner. Oh, you're muted there, bud. There you are.
Thanks, Justin. And I should probably apologize to the group to start, because last time I chaired this committee, Justin ended up becoming president. And right now, but as he said, I had the honor of chairing with past presidents Peggy Schmitz, Lynn Mumal, Bob Gorman, and Kim Sayers. As a reminder to those on the call, the requirement to be a board member is to have been a Worcester Rotarian for at least 2 years. The requirement to be vice president is to have been a board member for at least 1 year. And as Justin said, we typically have these nominees spread out on the tables, but this year he sent them out ahead of time in the Zoom call invite. And I also want to make a note here that it should be noted that Peggy Schmitz recused herself from the vote for board members. At this point, is there any discussion or nominations from the floor?
Adam, do you? Oh, I'm sorry. Go ahead.
Go ahead.
Just you'll go over those names as two. You'll read those out.
I was going to say them at the end, but I'll just tell everyone, if you didn't see the email, the nominee for vice president is Greg Long. The nominees for board members are Katie Kogelman, Joy Schmitz, and Tom Rumball. Are there any discussion or nominations from the floor?
Adam.
Bill?
Mr. President, Mr. Past President, I make a motion that we cast a unanimous ballot for that we close the nominations, and cast a unanimous ballot for the candidates presented.
I second that motion.
We have a second from Frank Relly. All those in favor, raise your hand. All right, I would say a Zoom call round of applause is in order for Vice President-elect Greg Long and future board members Joy Schmitz, Katie Kogelman, and Tom Rumball.
Not bad, Adam. We appreciate it, man. We appreciate
Greg, the glass floor has been officially removed. A charter member of the Raccoon Corner is now going to be president. I love it.
Yeah, congratulations, Greg. Congratulations to our board members. So, Adam, thank you for the time that you and your committee put together. Greg, do you have anything you want to say?
I never heard of the glass floor, but it's nice that I got to break it.
Yeah.
But, no, I'm honored. I very much look forward to it. And the sooner we can get back meeting face to face, the happier I'll be, because I think it's the only way we're truly effective, where we can truly operate. But you're making do under very adverse conditions, you and Kim both. So I give you full credit for it, but we're at our best when we're all together.
Absolutely. Well, congratulations, Greg. And again, congratulations to the three board members as well. Adam, thank you for your service, and all the nominating committee members that are on this call. Thank you. We appreciate it. Does anybody else have anything for the good of the order in the way of announcements, or like to share any news with the body here before we kick things over to Greg Long, who will be introducing our speaker? Any announcements, anything to share? And Greg, you are queuing up Bill, correct?
Yes, I am.
Okay, well then, hey, guess what? The president-elect, the newest, it's over to you, bud.
All right. Well, it's my great pleasure to introduce you our speaker today, although I don't really think our speaker needs much introduction. We've had him here many, many times, and he is still invited back. I still can't figure it out. But our speaker, of course, is Bill Sheron, our president and CEO of the Worcester Community Hospital. Bill, according to certain members, has a BS degree in business administration. I would argue it's a Bachelor of Science from the University of Vermont, and a master's degree in health administration from the University of South Carolina. With 35 years as a hospital CEO, Bill began his hospital career at St. Luke's Hospital in Richmond, Virginia, and joined Worcester Community Hospital in 1994. He has been named the National CEO of the Year by Quorum Health Resources and also CEO Innovator of the Year. And I was at both of those ceremonies with him, and he was well-deserved awards. Under the direction of Bill and his leadership team, Worcester Community Hospital is named one of the top 100 hospitals in the United States 6 times. And in 2020, we were named the best medium-sized hospital in the United States by IBM Watson and Fortune magazine. In 2020, Newsweek also named Worcester Community Hospital as one of the top hospitals in the world. Bill is also known for, by many of you, for his involvement in the community. He served for many years as a youth sports coach, was board chair of the Worcester Soccer Association and Wayne Center for the Arts, and most recently, Worcester Area Chamber of Commerce. He serves on the board of Worcester Growth and has been a member of Main Street Worcester Board and Worcester Board of Worcester Chamber Music and WKSU Public Radio. He also proudly serves on the board of Pinky Romy Company. Bill and his wife, Carolyn, have lived in Worcester for 27 years and have 3 grown children.
Oh, just give it a
Fellow
minute.
Rotarians, Bill Sheron.
Excellent, Bill.
Thank you, Greg. Well, thank you for inviting me back. It doesn't seem that long ago I was here.
Yep, here it
through
comes.
this,
Just stand away.
And I know there's a lot of questions in the community about what's going on with COVID and so forth. So I hope to address some of those today. Well, I guess I want to start out by also wishing everybody a happy President's Day. And I know I'm dating myself, but I'm old enough to remember when we had 2 President's Days. We had Washington's birthday and Lincoln's birthday. We got 2 days off from school, and I used to like that. Now we're condensed it down to 1 day, but happy President's Day to everybody. So when Greg and Don Noble first asked me to put together this presentation, they asked me to talk a little bit more than just COVID. So what I thought I'd do is talk about what's new at the hospital, and then get into the whole COVID and vaccination issues. So one of the things our hospital did early on in the COVID process, last spring, in fact, was to decide to do a strategic plan in the middle of this COVID pandemic. A lot of hospitals, a lot of companies said, let's wait till this ends. We'll see, what changes. We had no idea how long this COVID epidemic would last. And in fact, I'm glad we went ahead with the plan because obviously we're still in the middle of it. But these are new things to the hospital really within the last few months. The first is the expansion of EP services. So EP really stands for electrophysiology. Electrophysiology is that branch of cardiology that has to do with rhythm and the pacing of the heart. So anyone with a irregular heartbeat or a pacemaker or any kind of electrical functions, we actually provide those services here at Worcester Community Hospital. And the electrophysiologist who does that for us is a gentleman by the name of Dr. Emil Dowd, who is the chairman of the electrophysiology department at Ohio State University. So he comes up here on a regular basis and sees patients at our hospital and is going to expand those services significantly this year, in 2021. And it's really through the generosity of some existing donors in our community that allowed us to buy additional equipment to outfit this EP laboratory to offer these new services. So very shortly, you'll see us doing some marketing to explain specifically what new services we will offer. I'm not a doctor, as you all know, but what I've been told basically is there's the left part of the heart and the right part of the heart. And if it's got to do with the right part of the heart, we can do it in Worcester. If it's got to do with the left part of the heart, we can't. Another thing that's new this year, or relatively new, is spine surgery. We actually have 2 dedicated fellowship-trained spine surgeons in Worcester, Dr. Watt and Dr. Newton, and both are quite busy and working at the hospital. So again, we've never really had, we've always done some spine work, but we've never had, only once before did we have a dedicated spine surgeon, and he left a number of years ago. The hospital has opened up a clinic down in Mount Hope. This, like the other 2 items, were part of our strategic plan. We met with some Amish representatives, and we put together the plan, and they said they would like to see us have an outreach clinic down in Holmes County, and they specifically recommended Mount Hope. So That clinic opened last week. This is the second week we're seeing patients, and we're excited to be down there. Stroke care is another thing that we've significantly expanded at the hospital. We are part of a stroke team that's supervised by Ohio State University. So the way this really works is if a patient comes to our emergency department and is having an active stroke or is suspected having an active stroke, our emergency room physicians immediately put them on a kind of a Skype call. We have a robot which connects to Ohio State University, and their stroke team down there can immediately assess the patient and see what is needed. Do we need to give them clot-busting medication? Is it an ischemic stroke? Is it a hemorrhagic stroke? And I will just say in the entire OSU stroke network, which is 20 plus hospitals, our what they call door to needle time, which is the time when you first diagnose a stroke to the time you give clot-busting medication, it's the best in the whole system. And we've, as you know, when you have a stroke, time is very, very important to get those arteries or the blood flowing again. And we've, our average is way below the national average and the best of any hospital in the OSU system. Also brand new is Medicare now, like everybody else, ranks hospitals. And they have sort of taken up after Amazon and some of these other folks, and they rank you by 1 through 5 stars. So we were told last week that Worcester Community Hospital has been given a 5-star ranking, which is the highest ranking you could get by Medicare. They will make those announcements official in early April, but I would encourage you to go online and look. But I think you'll be surprised to find out how few hospitals in our region have a 5-star ranking. So we're really, really pleased to have that. We had that last year as well. We've expanded our diabetes care program, and we have a clinic out at our Eagle Pass office with Dr. King, who is a diabetes specialist out there. We've also expanded our behavioral health services. A great deal of mental and behavioral health needs in our community. This always shows up in our community planning. And our behavioral health services are rendered in the old Western Reserve Lightning Rod building, which we now call the Bell Professional Center, adjacent to the hospital. Another thing that we've done this year, as Greg mentioned, we've won all sorts of awards, pretty much every award we ever could have wanted to win. But we are now going to seek the Malcolm Baldrige Award. And that's not just a healthcare award, that's for industry. I think many of you are aware of that. So we have formally applied to the Baldrige program. They will be coming here next month to do kind of a survey of us. And usually you don't get this award the first time out. We don't expect to, but we are on the journey to hopefully someday be a Malcolm Baldrige Award recipient in Worcester, Ohio, and we'll work very hard to do that. One other thing, we're opening up our retail pharmacy. We've had a pharmacy here in the hospital for a couple of years, but we are now going to have a drive up, which will be on the north side of the hospital as you drive toward the new outpatient pavilion. And we've got a lot more square footage in that retail pharmacy. So the pharmacy will open in March, and the drive up will open up in April. Finally, we were given, again, within the last couple of weeks, the Health Grades Excellence Award for Cardiac Intervention for the year 2021. It wasn't that many years ago, we did not offer cardiac intervention, interventional cardiology at the hospital. And in the short time we've got it, we have tremendous success statistics, pretty significant volume as well. And we're really pleased to get that award as well. But needless to say, most of what's happened here at the hospital, most of what's we focused on in the last year has to do with the COVID pandemic. And, you know, we've been involved in testing, we've been involved in treatment, and we've been involved in vaccination. So I'll bring you up to date on kind of all of that stuff as we go. I'll start out by saying we're seeing a tremendous decrease in the number of COVID patients in the hospital. We have only 6 patients in the hospital today. Through the entire pandemic, we've had a high of 32 COVID patients admitted into the hospital as inpatients, and obviously we've been as low as 0. As I think I mentioned the last time I spoke, early on, about last March, the state of Ohio had dire predictions for inpatient COVID census at the hospital. And at one point, the state was predicting that we would have 270 COVID patients in Worcester Community Hospital at one time. We only have 172 beds, so that would have been a hard trick. But needless to say, we've never gotten above 32, and I've never really had resource shortages. I think only once or twice were we actually at capacity where we would have had to turn patients away had we had more. And actually, we have taken transfers of COVID patients from hospitals around the region. So we seem to have this kind of well under control. And we talk to every other hospital in the region on a daily basis. Everybody's COVID census is declining, which is a great thing. And we can talk a little bit maybe about why that is. But, you know, operationally, COVID has had a severe impact on the hospital, as has probably every other business in town. I mean, we've seen our revenue drop between 15 and 20%. People are still afraid to go to the doctor and still afraid to come to the hospital. And we think this is one of the safest environments in the community, but I understand that people are still afraid and somewhat reluctant to come. So that very much affects our volume. And certainly we've had to do short-term hour reduction of our employees, to furlough employees, to reduce expenses like many other businesses in town have had to do. And were it not for the federal CARES Act money, we'd have been hurting. But the CARES Act money really helped us, and we came through it well, and really have not touched our reserves. So that's an important consideration. So I'll get into the whole COVID statistics now. The first slide you see is Ohio. So some of the data will be Ohio data, some will be U.S. Government federal data, and then local Worcester Community Hospital data. So the first chart, and all this data, by the way, is current as of the last week, not current as of today, but as of last Thursday when I put these slides together. So what I wanted you to see on this slide is a couple things. So this is hospitalization rate per positive cases. So this is people that test positive and need to be put in the hospital. And you can see at the left-hand side, the overall rate of hospitalization for COVID positive cases is only 5%. But obviously it varies significantly by age. So when you get to the 70 to 79% age group, you'll see it goes up to 17.5%, 80 and above, 21.21%. So the folks that are most at risk for hospitalization and are the sickest, as we have known all along, are the folks at the high end of the age range. But overall, that rate of hospitalization is just over 5%. And Megan Boyer, thankfully, is helping me with these slides. So the next slide is also Ohio data. And this is active COVID cases in Ohio as a percentage of the population. So you can see it ramped way up, you know, back in November and December, but has fallen off pretty precipitously since then. But what I want you to understand, I guess what I would love everybody to understand is, despite all the ups and the downs, the active COVID cases in Ohio, and again, Ohio's got a population of 11.7 million, is way less than 1% of the population, considerably less. So although this is a terrible disease, it can be a very harmful virus. Really, when you look at the percentage of the population affected by it that have to be hospitalized, it's extremely low. The next graph, this colored one, I think is an interesting one, and I kind of wish the national news would spend more on this graph. So what you see in green is total cases. And you can see the number of cases in Ohio and across the country has risen significantly during this pandemic. But again, those are people that test positive. What you see under it, the big green is recovered cases. So these are people who got the virus but recovered. The people in yellow are active cases, and then you can hardly even see it. It's red on the bottom is the number of deaths. So sometimes when you turn on the national TV, they talk about, oh my gosh, we've got all these cases, and we have had a lot of cases, and we have had, you know, more than 400,000 deaths in the United States. But realistically, most people that get COVID recover, and most people, as we already said, don't end up as patients in the hospital, including our hospital. So this again is Ohio data, positive cases and deaths. So this is what's interesting to me in this graph is we can't confuse people. At first, I think people thought, well, the only people that are getting COVID are the elderly, and that, you know, school-age kids and younger people aren't getting COVID. Well, that's not true. As you can see in the second column from the left, that's age 20 to 29. That's the largest cohort of people who've gotten COVID. 50 to 59 is the next. So certainly people at younger ages can get COVID and have had COVID, but again, it's the seriousness of the disease. What you can see in red in the bottom right-hand corner, those are deaths. So we have positive cases in blue and deaths. So you can see that the death rate is really low, excuse me, compared to the number of people who've tested positive. Next graph is also Ohio, and this is deaths only. So this is total cumulative deaths. And this is total cumulative deaths in Ohio.
I'm sorry. There we go.
That's okay. Is less than 0.1%. So it's 0.99%. So 1% is the top line at the top of this chart. So you can see the death rate is extremely low, and the median age of death in Ohio is 80 years of age. The next graph is USA data. And again, this is total cumulative COVID deaths across the country. The circled number at the top is 1%. So you can see across the United States, it's 0.138%. So significantly less than 1% of the total cumulative cases of COVID are deaths. And again, sometimes you read the media and you think it's, you know, the sky is falling and you can't go out of your house. This graph is very interesting. So this is deaths per million population by state. So there's 50 states here, and if you see the red line in the middle, that's the mean, that's the average. Ohio is the white line. So if you look at us, the state of Ohio has done very well in terms of deaths per million. If you can't see it, it's even hard for me to read it. All the way on the right, the state with the lowest deaths per million, my former home state of Vermont. The two states with the most deaths are New York and New Jersey, and Massachusetts is third. So, and again, that's not just, you would say, well, sure, a lot of people in New York died, they have a huge population, but this is a rate. So this is deaths per million. So New York and New Jersey have had a lot of problems with COVID deaths, and you've seen that on the national news as well. But Ohio, I think, has done very well, and as you can see, we're at the point where we're almost at the late, you know, certainly the lowest quartile there. So the red line is the median, and we're in the lowest quartile. So really, the COVID, the worst seems to be over here in Wayne County, and hopefully in the U.S. I know we've got these variations of the virus, and you know, it's the South, you know, African variant and this variant. We don't really know where this is going to go. I mean, but clearly the numbers are down. They're trending down, and now we're at the next stage, the positive stage, which is the vaccine stage. So again, this data is based on last week, but statewide vaccine status, we've given 31,000, just over 31,000 start doses of the vaccine. Again, they're 2-dose vaccines. That's 8.6% of the population had gotten started as of last week, and that's over 1 million people had started. And if you see the histogram on the right, again, we started by age, so 80 plus, about 55% of that population. And by the way, these numbers have gone up since then. We are helping the health department here at the hospital giving these vaccines, and we were tasked with giving the oldest age cohorts first. And we're giving them as we speak today, but more and more people are getting the vaccine, and I think that only helps drive the numbers down. So the next graph is, again, vaccines given, first dose and second dose, or started and completed. So you can see, we're at 9% started and about 3% completed. Again, folks who've gotten the second dose. I've gotten, both doses now, and I feel feel pretty good about things and where we're trending. And I know there's a lot of concern about why can't I get my vaccine? Again, those doses are paid for and sent out by the federal government. Ohio decided to distribute vaccines through the health departments. Not every state did that. A lot of other states distributed vaccines through hospitals, the big hospitals, but Ohio chose to go through the health department. So they're getting the vaccines and then kind of distributing them out from there. One of the questions actually Greg Long asked me is, how do you get off of a red alert? You know, the state has these alert indicators, and you know, the indicators are things like new cases per capita, sustained increase in new cases, proportion of cases not in a congregate setting. I'm not sure how you measure that. Sustained increase in emergency department visits, sustained increase in outpatient visits, sustained increase in intensive care visits. But basically the state has a formula, and the formula says, if you're in red, you must be at or below 100 cases per 100,000 population for 2 consecutive weeks to move down off red designation. So the state has their own epidemiology folks working on this, and that's how you know, that's what kind of drives what color you're in, your county, your area, because it is sort of frustrating. We think the worst is behind us, but you know, we still maybe haven't moved off because of you need to do it for 2 consecutive weeks, and the health department is monitoring that data. So now I guess I'll talk specifically about our hospital data. So one of the questions we've been hit since early on is, you know, what kind of testing can you do? Can I get COVID testing at the hospital? We have 2 platforms for COVID testing: the molecular testing, the kind of relatively rapid turnaround testing. The problem we have had since the beginning, and it persists today, is we just don't have the supplies and the reagents. So although we have the equipment to run these tests, we haven't had the supplies to test everybody. So we've had to make decisions about who we will test. So obviously we've tested anybody who shows up in the emergency room who is symptomatic. We've tested anyone who's scheduled to have surgery at the hospital. Those are the people that we've sort of set aside the testing for. So we've had to make sure we've had enough testing capability for our inpatients, our emergency room patients, and our surgical patients. So that's why we, the hospital, have not been able to just mass test everyone in the community. We haven't had the supplies to do that. We also do antigen testing. So antigen testing is an antibody that'll detect if you have the immunity or not. If you've already had COVID, you should have antibodies. And we've done a fair bit of antigen testing, and that's actually becoming more popular here at the hospital as we go by. So we've done almost 20,000 COVID tests at the hospital, only 27,000 people in Worcester. Now, when I say we've done them, many of them we send out to reference labs. In the hospital, we've done almost 8,000 here. The rest of that, almost 20,000, so the 12,000-ish, were sent out to LabCorp and Quest, reference labs out of state that turn these tests around in 2 to 3 days. We have, as I mentioned, 2 testing platforms. Antigens are molecules capable of simulating immune response, and then there's antigens and antibodies. So antibodies are proteins that are produced by cells in response to exposure to antigens. So again, if you've had COVID, you probably have antibodies that said you did have COVID, and we've done a fair bit of antibody testing. We've also done some treatment. We've done monoclonal antibody treatment. So candidates for monoclonal antibody treatment are folks that have tested positive, are symptomatic, but aren't sick enough to be in the hospital. And what those people do is come to the hospital and get an IV for about 2 hours, and they get IV therapy, and then they're sent home. And those people have done very, very well with monoclonal antibody therapy. And we've done, about 100 of those treatments in Worcester in the last, I would say, month or 2. When we look at the testing, the number of positive tests, so we told you how many tests we had. We've tested almost 2,100 positive tests. So our positivity rate, which is what we look at to determine what we think is coming in the community, is about 10%. So 10% of the people that we have tested for COVID have tested positive. It's been as low as 3 or 4%. And then in December, we got as high as 35%. When our inpatient COVID population spiked here, we could tell that was happening because we were getting so many positives tested in the community. And I know the mayor and I have talked about, are there other metrics we can look at in the community to predict when COVID is coming? This is really the best thing we think we can kind of come up with. Again, back to treatments. You've watched TV, you've seen all the treatments that the inpatients have had. Remdesivir is, that's the antiviral that President Trump got. We've been administering remdesivir right along. We've administered almost 1,100 doses of remdesivir. It's done very well on our patients. Our patients overall have done extremely well with the COVID virus. We were told to expect lengths of stay, the period of time for COVID patients to be in the hospital, to be 17 to 20 days by the state of Ohio. Our average length of stay, and again, this is over a year now. We've been treating COVID patients since last March. Our average length of stay for these patients is just over 5 days. So our patients have been less sick than what you see on the national TV. Vaccines, we've given almost 2,200 vaccines. One of the disappointing things to me, we did not make the vaccine mandatory for hospital employees, and only about 50% of our employees took the vaccine. They were concerned, did the vaccine get pushed out too soon? Was there another vaccine coming that was going to be better or easier? And I understand that, but we had about 50, maybe 52% of the employees were vaccinated. All our employees that got vaccinated have now had 2. And the physicians, this number is actually higher. It's up to the 80%. So almost all the doctors got the vaccine and have had their second dose. And then as requested, as you know, by the state, you can request to have your vaccine done at the hospital. I'd like to say that the elderly people, the people that are most at risk, we feel safest administering the vaccine here at the hospital, just in case there's a reaction. We've really not had any serious adverse reactions to people. I know Greg and I kid each other. We got the vaccines a day apart, and we had 0 reaction. But some people have had dizziness. Some people have had headaches. Some people have had sore shoulders and body aches and chills and fever. But most people have had very, very minor reactions. All the vaccine we've given out at the hospital has been the Moderna vaccine. We requested both Pfizer and Moderna, but we were only shipped the Moderna vaccine. And as I said, the schools are now getting the vaccines, and different agencies can request who they want to administer them. I know the Wayne County Care Center, for instance, asked the hospital to do theirs, and we're more than happy to do that. So kind of summary statistics at our hospital, we've had 100, this is over a year. We've had 144 patients with a diagnosis of COVID positive in the hospital. 38 of those patients expired, passed away here. So that's a mortality rate of 9.2%. When we look at all deaths in the county, this next chart is really hard to see. I agree, but Wayne County, since the beginning, has had just over 7,500 cases. We've had 362 hospitalizations, but as I just told you, we've only had 144 patients in the hospital. So most of those patients have not been here. And there have been 183 deaths in Wayne County in the last year. But again, there've only been 40 here at the hospital. So the question you may ask is, so if they're not passing away at the hospital, where are they passing away? And the answer to that is really long-term care facilities for the most part. But there's some silver linings here too. And I just want to tell a couple stories that I think are useful. So, when you go through this in the last year, you think, boy, how does it get much worse than this? Because, we're testing employees. We can't let visitors come into the hospital. We've got all these dire predictions from the state. You turn on the national news and they tell you there's not enough ventilators and ICU beds. We've had none of those issues here in our hospital. But I guess I want to share kind of 4 upbeat stories with you because I think it says a lot about our hospital and even more so about our community. The first is I call it the diaries. So when you do get COVID and you have a really bad case, you're in the intensive care unit, and if you're on a ventilator and you're in an intensive care unit and your family can't visit you, frankly, you don't know what day it is. You don't know how long you've been in the hospital. You don't know whether you've been here for 3 days, 10 days, 15 days. Many patients get disoriented and lose track of time. So one of our nurses came up with an idea of doing diaries, personal diaries for these patients daily for them. So what the nurse does is jot down milestones that happen for that patient every day. And then when that patient comes off the ventilator, they can share with them, on Monday this happened, on Tuesday this happened. We talked to your family on this day. I thought that was a brilliant idea, and in fact, that diary idea was picked up by the American Hospital Association and now used as a best practice in hospitals all across the country. And that idea was really thought up by one of our ICU nurses here. Maybe my favorite story, I call it the tailgate. So this was a number of months ago. This is around the time when there were all sorts of protests around the country for all sorts of different things. So I got a call up in my office one day that there were a bunch of people appeared to be protesting out of the parking lot by the obstetrics unit, the women's pavilion. So we got a few male bodies together and our security people and went down to see what was going on. And as we walked to the parking lot, there was a crowd of people and they were milling around, and we thought, I wonder what this is all about. So we walked up to them and said, can we help you? And they said, yeah, we're celebrating a birth. And I said, what are you talking about? They said, well, we just had our first grandchild in our family, and we can't get in to visit the grandchild. So we're standing outside the window tailgating in celebration of this grandchild's birth. I just thought that was so cool and so Worcester and so Wayne County. And so we just said, hey, have a good time, play cornhole, whatever you do, just try not to block traffic. Last week we had another cool thing. One of the firefighters in the township was in our hospital for COVID and was quite ill, and his coworkers were very concerned about his well-being. So they arranged for a parade of the various fire departments to come and do a lift truck and look in the window to make eye contact with this individual to say that we remember you, we were thinking of you, and they lined up outside the hospital. That got picked up by Channel 8 News up in Cleveland. And then gifts of kindness. Throughout this whole pandemic, we have had people delivering food to our employees, bottled water to our employees, homemade masks to our employees and visitors. The unsolicited gifts of kindness for our community are just more than we could count. But again, it says a lot about Worcester and how people treat each other, both at our hospital and in Wayne County. So we've learned a lot, and this is my last slide. I would say we've learned a lot about COVID along the way here. Certainly, we've learned, and this persists today. People are reluctant to seek healthcare services during the pandemic. They don't want to come to the hospital. They don't want to come to the doctor. There's a lot of things they just are afraid to do, and that still occurs today. Our patient volumes are still down because people are afraid they're going to get the virus in the hospital. And as I said earlier, really, this is probably one of the safest environments for COVID because of the screenings we do, the special cleanings we do. Obviously, we've been doing temperature checks. We've restricted visitors. We've gone all out to protect our patients. And we've done our own contact tracing. We have had, as far as we know, less than 2 employees that have gotten COVID at the workplace. We've had patients that have gotten COVID, but they've gotten them in the social settings outside the hospital. So we think we've done a terrific job of keeping people safe and the environment sterile, but I understand why people are still reluctant to come in. We also understand that not everybody wants the vaccination. It surprised me, the percentage of people that didn't want it, but people are calling every day wanting these vaccinations, and we will give them out as soon as we can. Again, our supply of vaccinations has been kind of being reduced, our hospital supply. Originally, we had 600 doses. Then we got an additional 300, which we gave out to all our employees and the medical staff and our volunteers. But the last couple of weeks, we've only been getting 100 doses at the hospital. to give out. We have 100 doses we're giving out today and tomorrow, by the way. I think our outcomes with our COVID patients have been absolutely outstanding. I talked to a lot of people in big hospitals around the country. Our length of stay, our treatment, what we're giving these patients, what we've learned clinically, it doesn't matter what size hospital you're in. The care here, I think, has been every bit as good. The major reason to get the vaccination is the long-term risks associated with COVID are unknown. One of the things that they've seen around the country from COVID patients who've died, and they've done autopsies on these people, is that they have a lot of blood clots. There's a proliferation of blood clots. So the question is, if you got COVID, if you have COVID, what does that mean for you long-term? Could you develop blood clots in your lungs, or is this something that could affect your heart? And we don't know the answer to that. So all the more reason, in my opinion, to get vaccinated. COVID transmission vectors are still not fully understood. As you remember, early on we were told, wipe down every surface, every doorknob, every time you went in and out of the bathroom, and I think people were very concerned that that's how the virus was being transmitted. I'm not sure now. Now it's masks and oral transmission, that sort of thing. So I'm not sure we fully understand how this virus goes from one person to the next. It is highly contagious, however, though. Again, very few of our hospital employees and physicians got COVID. Again, we have 1,200 employees here, and we've had less than 10 people that work here that have gotten COVID at the hospital. Another thing on more of a macro level, as we work through this COVID pandemic, we're starting to see other gaps in the healthcare system that are going to be exposed because of COVID. One of the things that reaches out to me, although it doesn't directly affect the hospital, is what happens with Alzheimer's patients. So many of these patients are being taken care of by family members, either in the home or they're in a long-term care facility and family members visit them and bring them meals. Well, they haven't been able to do that. So there's been lots of gaps in care, and I think that's only going to be a problem going forward. Remember, most Alzheimer's treatment is not paid for by Medicare. So it's, I think we're going to have some issues beyond the acute care phase of this COVID pandemic when it's over and when it winds down. And then telemedicine. Telemedicine is something we were trying to utilize more and more. I think this COVID epidemic is going to push that into the fore. Many of our doctors are already using telemedicine. You're seeing it advertised on TV all the time. More and more companies are getting into the business. So I think that is here to stay, and the use of it will grow. So as I said earlier, I appreciate you letting me speak. This is probably more information than you wanted to know, but we're down to a relatively few number of cases in the hospital and the county, and overall our statistics have looked great. I'm done.
Bill, it's a great presentation, and knowing you from your time not only presenting in the past but at the chamber, you're always open to any questions we might have. There's a number of them here, so maybe we can just fly through a couple of these. You answered some of those. One was the long-term health issues, which you kind of hit on. Is there an easier way to register to receive a vaccine at the Worcester Community Hospital? Some confusion on the lack of local coordination. Is there a way to register at the Worcester Community Hospital?
Well, you can't go directly through us. So the way the state set this up, it's to be done through the health department. So what happens is the health department gathers lists of people that either email them or call them, and then they distribute the list to us. So for instance, they gave us the list of all the 80 and above year old patients that we work through here. So really you have to go through the health department.
Okay.
And I know there have been some issues there. We're only assisting in that role.
Okay. Question here: is there any reason that the public schools should not fully open for in-person instruction? Obviously, that's an opinion, Bill.
Yeah, well, there's a loaded question for you. I think the answer is no. I mean, I know kids can get exposed, and I've seen what's going on around the country, but I also see what's going on around the country where kids are back to school, and in private schools, there seem to be having low COVID numbers. So I think that's a a question above my pay grade, and it's got to do with other factors. But I think we can get kids, especially young kids, back to school safely. I'll never get elected to school board, I'm sure.
Exactly. New federal guidelines indicate that vaccinated individuals who are exposed to COVID, that they must still quarantine if they are more than 3 months beyond the date of their last vaccination. Can you shed some light on that? What you're seeing within your within the?
Yeah, that's a good point. So unfortunately, they keep moving the goalposts on a regular basis. I had a hospital, a person called me and they had COVID. They had actually been through the monoclonal antibodies and they wanted, to take the vaccine, and they were told you can't for all these other reasons. I don't know the science behind all of that. I hope I'm going to trust the CDC with that, but I do feel that, these vaccines, from what I've heard, are pretty darn effective. Obviously, we'll know over time, but I don't know what all the nuances are with, the CDC changing the guidelines and the rules along the way. The health department is the best source for that information.
Yes. Scott Allen asked a question here. You stated that the Worcester Community Hospital has achieved a 5-star Medicare rating. What does this really mean for the hospital, Bill, and how is life different for those who maybe aren't at that rating?
Well, what I wish it meant, Scott, is that we got paid more money because we got 5 stars than the other hospitals. But the reality is the average hospital in the United States is a 3-star hospital. So what that means is Medicare developed their own criteria for quality of care, and they're saying Worcester Community Hospital is, and again, the final publication will be early April, but it'll put us in the top 10 or 15% for Medicare for quality of care of all hospitals in the United States. But we've already been living there, so but to us it's actually a big deal. As I said, when these things get published, you take a look at the hospitals that aren't 5-star, and you'll be surprised.
Are there any other questions out there for Bill? Bill, I know you've been a faithful supporter of Rotary from a speaking perspective, and also membership as far as supporting a number of members through the years. And Bill, we appreciate your time today. The slides were fantastic. We did record this session, so we will share that with those members who weren't able to attend today.
So would you please tell Greg Long that he owes me a virtual Rotary lunch?
That is right. Yeah, exactly.
Absolutely.
Anything else? Anybody else?
I enjoy this. I will come anytime you want, and just wind me up and I go.
Bill, I'm going to put your application in the mail because we want you as a Rotarian.
This what I need, Greg, is another meeting every week. I mean, I don't know if you know this, but when I came to Worcester, I was a former Kiwanian, and they were all over me wanting to keep it going, and I just didn't feel like I should pick one group over the other. And honestly, I do have a fair number of meetings during the day. So, but I'll, when you become chair, you make a pitch to me, and I might be susceptible.
We have a special running right now for ex-Kiwanians.
Excellent. Bill, thanks so much for your time. Everybody who logged in, we had just about. We appreciate your time today. And our guest, thanks for being here today. Everybody have a.
Thanks, Megan Boyer, for getting me through this.
Megan, well done. You kept Bill in line. And again, everybody be safe this week. Enjoy the pretty snow that it will be upon us this afternoon and evening. Take care. Have a good week. Thanks, Bill.
Thank you.